Hello, everyone. Welcome to this really interesting talk on giving effectively. Today, we're going to talk with Kari Kjørholt and Ulrik Johnsen. They're Danish and Norwegian Scandinavians from in. So give them a round of applause.
Thank you, everyone. I'm Kari. I'm Managing Director of Gi Effektivt. So we help people in Norway find and give to the most effective charities within global health and poverty alleviation. And we do this free of charge. And we also do individual advice to those who want to give away larger sums of money.
Hi everyone, I'm Ulrik. We do exactly the same in Denmark. I'm the director of Giv Effektivt. We help people find best-in-class interventions and make it easy for them to support it. All right, so first we'll spend approximately 5 minutes talking about why we, especially as people from the Nordics or other high-income countries, should give to a charity in the first place. And then we'll spend the remaining 20 minutes talking about how we can supercharge our donations and have an even greater impact.
So, as you all probably know, there are great needs in the world, and our money can go a long way to help the people that we need to help. But you might also know that we're well positioned to give in the Nordics. So this is a graph of the income distribution of the world. And it's probably not surprising to you that we as Scandinavians or Europeans are relatively wealthy from a global perspective. So if you have an average Norwegian salary, you are among the 2.4% richest in the world. And with an average Danish salary, you're even a bit richer, 2.1% richest. And this also accounts for the fact that money goes further in poorer countries and that things are relatively expensive here. What this means is that even if we choose to give away a larger percentage of our incomes, for example, 10%, and I say 10% because that's traditional in some religions and it's common in some social movement, like the effective altruism community, then you'll still be comparatively very rich on a global scale, and you can still live a comfortable life.
Well, at a personal level, I know it's quite possible to be happy and content, living very simply. And I believe I can say this with a decent level of confidence, as I've spent several years living in Buddhist monasteries and meditation centers after graduating from high school. But let's take a look at what science says about the relationship between happiness and wealth. So I'll present you with the results of a study made in 2010 by Nobel laureates Daniel Kahneman and Angus Deaton. Positive affect, not blue, and stress-free, they are all part of what's called emotional well-being, in this context at least. So what this graph shows is that once you reach an income level of around $75,000 on average, it stops having an effect on your emotional well-being. However, what's called subjective life satisfaction, which is how meaningful people think their life is, does actually keep on increasing even after reaching income levels of around $75,000 per year, although at a slightly less steep rate. And to be fair, revisions of the study has shown that even your emotional well-being can keep increasing beyond income levels of $75,000, but the gains tend to diminish as you reach higher income brackets. And what's worth considering here, and perhaps more importantly, is that some ways of spending your money actually can have a more significant impact on your own well-being than others. And that brings us to one of the most meaningful ways of spending your money, which is namely for the good of others. Many ancient cultures and traditions, including Buddhism, have emphasized the virtue of generosity. people like the Buddha said 2,600 years ago that if you knew the power of giving, you wouldn't let a single meal pass without sharing it with others. And science largely agrees with this. So researchers from the University of Zurich, they have indeed found that sharing your money with others can be a powerful way of boosting your own happiness. The researchers ran an experiment where they divided 50 people into two groups. One of them obliged to spend 100 Swiss francs on themselves over a month, and the other group was asked to spend the same amount of money on someone else. And can you guess who got the greatest boost in happiness from this experiment? Well, maybe not surprisingly, it was the second group who spent the money on others. So we both have the possibility to give and to share, and it can even improve our own well-being. But even though it can benefit others and benefit ourselves, we'd like to emphasize the importance of putting the recipient first, because they are, after all, the people that we're trying to help. And as it turns out, some ways of helping have proven to be significantly more effective than others. And that's why the rest of this talk will be about how we can supercharge our donations to get the maximum impact for the recipients of our donations.
Well, so how do we actually do this? If we want to increase the impact we can have through our giving, there are mainly two ways we can do that. The first one is to invest more resources or to give away more money. And the second one is to use those resources more cost effectively. So to get more value out of every dollar. But there's an important distinction here, because it's much easier to give money more cost effectively than to start giving much more money. So personally, I give away at least 10% of my salary to charities, and I could maybe double that or even give 3 times as much. But then my financial situation would start to be really crammed, especially if you also take taxes into account. But you can have a much greater impact if I give that money more cost effectively. And that's because differences in impact are huge. So here we see a graph from a study done by the World Bank, the World Health Organization, and others. It's the Disease Control Priority Study. And they've ranked a number of programs within health in low and middle income countries based on how many extra years of healthy life you can get for $1,000 spent on that program. And here they're ranked after their cost effectiveness. So it seems that about half of these programs do next to nothing. But actually, if we give to a program that's as impactful as program A, we get one additional healthy year of life for $1,000. And I know I would certainly pay that sum of money if it was my own life we were talking about, or the life of one of my close friends or family member. But we also see that we can do much better. The median program is about 5 times better, and the very best ones are as much as 330 times the impact. So this shows us that the differences in impact are actually huge. And if we're careful about how we give, we can supercharge our donations and quite easily get 10 or maybe even 100 times the impact for the same amount of money. So I want to give you an example of this. Let's say we're trying to increase school participation in Kenya. And we have 3 different programs that are trying to do that. The first one is the free school uniforms. So oftentimes in Kenya, they're required to wear a uniform to go to school, and that costs money. So it's a barrier to school participation. In the second program, they give scholarships to girls with good academic results so they can stay in school, maybe instead of getting a job to help support the family financially. And in the third program, we treat children for tropical diseases so they're healthy enough to go to school. So which one of these do you think is the most effective? Well, researchers have studied these programs, and I'll show you the results. If we give children free school uniforms, we get an additional year of schooling for around $1,000. That's pretty good. I mean, here in Norway, we spend about 10 times that per child in elementary school. But still, in Africa, the average is $350 per child in elementary school. So we should definitely be able to do better. And giving girls scholarships are better. So we see a 60 to 70% increase in efficiency from one program to another. And that's huge. But what about the treatment of tropical diseases? Well, if we give simple treatments to children to treat very common tropical diseases like intestinal worms, we get absolutely fantastic results. So here we see that we get an extra year of school for just $10. I hope this can again show you that the differences are huge between different interventions, but also that it's not always intuitive which programs work the best. In this case, we're trying to improve education, but it's not an education program that works the best at this. It's actually a health program. And that's a trend that we see again and again. But it's not just between programs we see large differences in cost effectiveness. We can also see it within the same intervention. For example, by giving out bed nets to protect against malaria, so malaria transmits through mosquito bites and mostly at night, we can effectively provide protection against the disease. But in Chad, the chance of contracting malaria, becoming ill, and dying from the disease is approximately 5 times lower than in Guinea. And that means that by distributing bed nets in Guinea instead of in Chad, we can do about 5 times as much. So there's also a significant difference there.
I hope my microphone is on.
I hope it's clear from Kari's examples that in charity, it's not just the thought that counts, because this can quite literally be a matter of life and death. Because our resources are limited, we can't help everyone. And when I choose to give to one charity, I'm simultaneously choosing not to give to countless others. That's why we have a moral responsibility to prioritize well and support interventions that can help as many as possible. And right now, resources are actually more limited than they've been in a long time. In 2025, global official development aid is projected to drop by $40 billion. The two largest donor nations, US and Germany, they are driving most of this decline. And some of the funds were actually distributed to very cost-effective health programs like those fighting AIDS and malaria. And this might not even be the bottom, this $40 billion drop. More more cuts are expected in the coming years. So with such scarce resources, it's even more important how we help and who we help. But how do we make that decision? Well, if you follow the news, you might get the impression that people afflicted by urgent crisis, they are the ones we should focus all our attention on. After all, there are so many to choose from. I mean, right now there are devastating wars in Gaza, Ukraine, and Sudan. And of course, it's really important that we help these victims of war. But we need to ask ourselves, do these stories that dominate headlines because they're dramatic and emotionally gripping, do they really represent what are the most severe problems in the world? Let's take a look at the causes for untimely deaths in the world. Every year, 5 million children below the age of 5 years, they die. And that's a real moral tragedy. Unfortunately, it is true that urgent crises do cause a lot of untimely deaths. And these data are even slightly outdated. They're from 2019. For instance, you can see that 13,000 children died in 2019 from conflicts. But in 2024, last year, it was 233,000 people that died from conflicts, largely due to the war in Gaza and in Ukraine. And this also includes adults and children above 5, so the numbers have gone up. But if we broaden the perspective, we see that there are devastating crises going on, and they've been going on for a very long time. And they're often forgotten about because they don't carry any news value. Just to highlight a few of these big black boxes, 360,000 children die every year of malaria, 500,000 of diarrhea, and 680,000 of respiratory infections. Now, let's take a look at this map, which portrays the mortality rates globally. So the darkest areas on the map, they are where the child mortality rates are highest. So in countries like Nigeria, Chad, and Somalia, more than 1 in 10 children, they die before they reach their 5th birthday. In contrast, in a country like Norway, it's just 1 out of 500. So a huge difference. Now let's try and compare this map with another map showing the number of people living in extreme poverty around the world. What becomes clear is this: the majority of child deaths are related directly to extreme poverty, and they are preventable. So in high-income countries, many of the diseases that children are dying from in poor countries, we've already eradicated them, or we have available treatments. That's why we see that low child mortality rates as 0.2%.
And malnutrition is one of the causes that is driving a lot of child mortality in the world today. But that is really no longer a problem, at least on a large scale in high-income countries. A lot of children in sub-Saharan Africa especially lack vitamin A today. That's a vitamin that's essential to the development of our eyesight and our immune systems. So when they're vitamin A deficient, they can become permanently blind, or their immune systems won't develop properly, and they are left vulnerable to a number of diseases. So it's estimated that around 200,000 children die every year from vitamin A deficiency. However, the solution is very simple and very cheap. For just $2, we can provide a child with 2 doses of vitamin A supplements per year, and that's enough for them to avoid these diseases. Another example is malaria. So almost every minute a person dies from malaria across the globe. And most of those are children under the age of 5. Earlier, I mentioned that bed nets are an effective way to prevent malaria, but we can also give preventative medicine to these most vulnerable children in the high season of transmission. And that costs just $7 per child per high season. Of course, if the parents could, they'd likely pay for this treatment themselves. But oftentimes, they just live in such severe poverty that that's not really an option for them, and their children are left vulnerable.
You might ask, why aren't all charity interventions effective at solving problems? Naturally. One of the answers to that question might lie actually in the nature of the charity market. But if we first consider the for-profit sector, the need for optimizing cost effectiveness is obvious. Because companies compete for market share, they have to optimize their products and their operations. Otherwise, eventually, customers won't buy their goods. For instance, if I buy a pair of shoes or a cup of coffee, I can very easily access the value for money. If the shoes are torn after a week or the coffee tastes horrible, I won't purchase those products again, and the store might run out of business. However, in charity, we are not the recipients of our donations, the products or the services that our donations can finance. And therefore, it's very difficult for us to assess the impact of our donation based on anything else than external information. And that information tends to come directly from the charities themselves. And a major problem with this is that we have cognitive biases that don't optimize for cost effectiveness either. So, first of all, we tend to give less when recipients are far away geographically rather than close by. And this is a major issue, at least in the context of global development aid, because most of the most severe problems are in far away poor countries. And secondly, we tend to give less when we are presented with groups of people rather than one identifiable victim. So this bias called the identifiable victim effect already got scientific recognition in the 90s. And it shows the likelihood of us feeling greater empathy and an urge to help when we are presented with one identifiable victim rather than bigger or larger groups of people. We also tend to give less when we are presented with facts rather than appealing stories. But as we've seen, the most cost-effective charities are the ones that work evidence-based and with facts. And funnily enough, conventional charities, the marketing department of these charities, they are primarily experts at telling appealing stories about identifiable victims. So it could seem, whether it's conscious or not, that they are actively exploiting our imperfect human brains. So my good friend, who's a PhD researcher in charitable giving and donor behavior at Copenhagen Business School, and he's also part of Giv Effektivt's external advisory board, he ran a fun experiment not long ago. So he signed up for monthly donations at the 45 different charities, and then he tracked all their communication with him over the months. So besides observing clear patterns in how frequently that charities they communicate to their donors, one finding that he made was that they tend to communicate very similar messages that are also fairly abstract. They tend to say things like, "Your support is making a significant difference. Thank you for the continued support of war victims. This girl thanks you for the food." These are probably all great, good interventions. I mean, what is very difficult here to estimate is like, when these claims are made, how could we accurately estimate the impact of our donation based on this? I mean, we just simply can't. And that's why we need the advice of the external evaluators, so that our donations can help the recipients as much as possible. because by collecting data and evidence from different interventions, these external evaluators, they can compare different charity interventions and see where each dollar can do the most good.
And GiveWell is one such evaluator. So they search for the charities that save or improve lives the most per dollar. So instead of narrowly reviewing a number of charities, they try to go deeper and find the very best ones. They look for these opportunities where there's potential for large-scale impact and progress, and when there are funding gaps. That's topics like vaccines, malaria, malnutrition, safe water. And they rank the programs based on how much it costs to save a life, to add healthy life years, or to improve living standards. So when we in Gi Effektivt and Giv Effektivt give advice, we mostly rely on GiveWell. They're really the gold standard for doing this research and for helping you improve the impact of your donations. So I'll just quickly run through a little bit more in detail how they do it. So first of all, they look to gather independent evidence on different programs to see how effective they actually are. And they also talk with subject experts to get practical insights and real-world data. Then they model their cost effectiveness. So how much do you get per dollar? They're quite extensive models, and they're based on data from these studies and from the organizations themselves. They conduct interviews with the staff at these organizations, and sometimes they also do site visits. And then they look at the budgets and ask the organizations for their past data and how their past programs went to assess their track record and performance. And lastly, and maybe the most importantly, they follow up. And if a program no longer meets their standard, they stop recommending it. So all in all, GiveWell spends about 60,000 hours a year so that you all can give with confidence and have a greater impact.
All right, so let's wrap up the core principles behind supercharging your donations. So first of all, we need to acknowledge that differences in impact are huge between interventions, and that we should spend limited money where they can do the absolute most good. Although headlines focus on urgent crises, long-term problems are actually more severe and they are cheaper to solve if we look at the data. And lastly, the charity market doesn't naturally optimize towards cost effectiveness.
And I hope it's clear from our talk why we would really recommend you to seek experts' advice in order to supercharge your donations and increase the impact of what you're already doing. I mean, there's just so many areas of life where we look to experts to give us advice before making important decisions. And I think this should also be one of them. I hope you leave this talk with an understanding that your donations can actually go really far, especially if you're thoughtful about how to give, and that you're motivated to give more and to give more effectively. And then, in addition, I just want to say that though these principles have gained significant recognition over the last decade or so, they're still new to a lot of people. So you can have an additional impact by sharing this information with your friends, your family, your colleagues, and help them also supercharge their donations. So if you want to learn more about the science of supercharging your donations, feel free to reach out to us or to visit our website. That's gieffektivt.no
and Giv Effektivt.dk. Thank you so much for your attention.